Hello, doctors. Welcome to our TDM class today. I'm very glad that you have joined us, to study at this very important TDM class. So I want to say that just invite your friends, to join us right away so that we can get this class going. We have a couple of people joining us. That is awesome. So I'll say that, send a link to your friends, especially those who are preparing for the TDM, that is the Therapeutic Decision Making Exam. So if you're asking me what is TDM all about, TDM is all about the Therapeutic Decision Making Exam, okay? Today we're going to focus on something very important. So I'm going to share my screen and then we'll get into the class right away. Therapeutic Decision Making. So doctors, I would like to give you a few minutes. Just invite your friends, just to join us, and then let's get the ball rolling, okay? So I'm just going to give you about 1 minute. Share the link with your friends. Those who are preparing for the Practice Ready Assessment Program, they should join us right away so that we can prepare for the therapeutics exam right away. Okay, so we are back, and we're going to get a ball rolling. So, yeah, we have Dr. Sabiha is joining us. It says, good evening, doctor. Good evening, Dr. Sabiha as well. So let's get into the game, okay? Get your friends to join and then to listen in and study with us so that we can go out there and ace the MCQ1 and the TDM exam, Therapeutic Decision Making Exam, okay? So what is today's class about? Today's class is, a very important highlight. We are going to throw light on something very important today, okay? Remember, in the medical counselor exam, we have the MCCQE1, the NACOSKI, and the therapeutics exam. This therapeutic exam is for those who are going into the practice-ready assessment route for family medicine, all right? So, like, for example, if you're going into SIPA or you are going into PRA-BC, any of those programs, you need to make sure that you've covered this. So, this is exactly what we are doing today. And I'm making sure that everybody gets access, and I'm sharing the link with everybody. So please, if you have any Facebook group or any WhatsApp group and you want to share the link with your friends as well, this is a time to do it. So do that right away so that we can get the ball rolling, okay? Let's get as many people as possible to hear the good news of TDM from MedCognito so that we can get so many people prepared for this exam. Please, don't also forget to subscribe to our YouTube channel right away so that we can get the ball rolling. So we are about to start about the therapeutics preparation, and I really want you to get things going. So doctors, make sure that you get your friends joining us right away. Make sure you get your friends joining us right away. Okay, so today we're going to deal with some common teratogenic medications you need to know, for your TDM exam. Some common teratogenic medications that you need to know for your TDM exam. And teratogenic means, medications and drugs which are dangerous to, the unborn baby. Okay, so that's exactly what we are doing today. And it's very important that we focus on it. So today I want you to make sure that, you pay attention and you are not concerned with any other thing. Get your friends involved. Please put off any other social media apart from YouTube and Facebook so you can watch this thing live, okay? And then we can get the ball rolling. So that's why I've put that one there. As well, you need your YouTube, but make sure that you're not disturbed by any other thing, okay? So let's do that right away and let's get the ball rolling. So TDM on teratogenic medication. So you know what? In preparing for the TDM, you have to know that there are medications with proven teratogenic effects on human fetuses, on babies. Okay, you need to know that. You need to know that for sure, that there are medications and drugs which have effects on babies. And even if you are learning from books like Compendium of Therapeutic Choices and all those things, one thing you always want to learn is, for every medication or medication class, you want to learn its effects on children, geriatrics, patients with renal impairment, regular adults, and not forgetting pregnant patients. Not forgetting pregnant patients. So that's something very, very important that I need you to, watch out for and deal with. So that's why today we are dealing with this particular topic. So, what are the list of medications or drugs which are known to have teratogenic effects? What are the names, or what are some of the list of drugs and medications which have teratogenic effects? The first one is ACE inhibitors. The next one is carbamazepine. Okay, these are drugs and drug classes which have teratogenic effects. And then cocaine, as well as steroids. Steroids, not throughout the pregnancy, but especially in the first trimester, because don't forget that if a patient has a medical condition in the second and third trimester and baby has to be born early, we give steroids to mature the lungs, right? So when are steroids dangerous in pregnancy? Usually in the first trimester, okay? And as well as drugs like warfarin, diethylstilbestrol, okay? Alcohol as well is also very dangerous. Valproic acid, methotrexate, phenytoin, lithium, okay? Misoprostol, isotretinoin, tetracyclines, and thalidomide. So these are common medications that I need you to master so far as the therapeutic decision-making exam is concerned, so that you can go in there to ace the exam and come home smiling. Okay, so we're going to take each of the medications I mentioned and then look at their actual effects on the fetus so that you can be able to master it very well. So let's start with ACE inhibitors. ACE inhibitors, doctors, please, I need you to write this one down. Or if you can even type it in the comment section, I'll be very glad. ACE inhibitors. What are the effects of ACE inhibitors on the fetus? What are the effects of ACE inhibitors on the fetus? The first thing you need to know is that ACE inhibitors can lead to intrauterine renal insufficiency. So I have a question, doctors, please, in the comment section, whether you are joining us on Facebook or YouTube, please type an example of an ACE inhibitor you know. An example of an ACE inhibitor you know. I need you to type it right away. What is an example of an ACE inhibitor that you know? I want you to write the name of the medication. ACE inhibitors. I want you to write the name of an ACE inhibitor that you know. I'm waiting. ACE inhibitors. I want the name. Because today we are learning about teratogenic drugs and we are learning about ACE inhibitors. But I want to see you write the name of an ACE inhibitor. Okay? I'm just waiting for answers. The name of an ACE inhibitor. The name of an ACE inhibitor. Beautiful. So we have captopril. I think Dr. Sabi has just written captopril. Any other medication? Any other medication apart from captopril? So as soon as you start mentioning the prils, you are thinking about ramipril, right? You're thinking about all these medications which end in PRIL. So what are the teratogenic effects of ACE inhibitors? Intrauterine renal insufficiency, so it affects the kidneys. Neonatal hypotension, okay. Neonatal renal failure. Another medication has dropped, enalapril, okay. Hyperkalemia, oligohydramnios, that is decreased fluid around the fetus, and the oligohydramnios can lead to fetal limb contractures, lung hypoplasia, that is underdeveloped lung, craniofacial abnormalities, and then prematurity as well, and intrauterine growth restriction, okay, as well as fetal death. So these are complications of the use of ACE inhibitors in pregnant patients. Okay, so doctors, please make sure you've written them down because I'm moving to the next medication. Make sure you've written these ones down because I'm moving to the next medication. Okay, So another medication which can be teratogenic is carbamazepine. Carbamazepine. And with carbamazepine, what are the common teratogenic effects it can have? It can have neural tube defects, and it can have cardiovascular malformations. So carbamazepine, it can have neural tube defects as well as cardiovascular malformations. Neural tube defects, carbamazepine can go with neural tube defects as well as cardiovascular malformations. What about cocaine? Patients who abuse cocaine. What are the effects of cocaine on the unborn baby? It can lead to placental abruption. That is, premature separation of the placenta from the uterine bed. It can also lead to prematurity. It can lead to fetal death. It can lead to decreased birth weight. It can lead to microcephaly, that's a small head in the baby. It can lead to limb defects. It can lead to urinary tract malformations, as well as poor neurodevelopmental development. Okay, so poor neurodevelopmental development can occur as a result of the use of cocaine. And this information is also very good even for your MCQ1 exam and your NACOSKI. So if you have any friends who are also preparing for that, tell them to join us and let's get the ball rolling. All right. Now, remember that I talked about corticosteroids, right? So steroids in the first trimester of pregnancy. I didn't talk about the second or the third. Steroids in the first trimester of pregnancy. What are the concerns we have? It can lead to oral cleft. So maybe the baby will be born with, a cleft palate or, a cleft lip. Okay. So oral clefts, usually if you use steroids in the first trimester of pregnancy. All right. What about warfarin? So you have a patient who probably has some atrial fibrillation and that patient is now pregnant. What are the effects of warfarin on the baby? Warfarin can lead to what we call fetal warfarin syndrome. Okay, fetal warfarin syndrome. It can lead to that. It can also lead to intrauterine growth restriction. That is the effect of warfarin. It can lead to intrauterine growth restriction. So please, doctors, you need to know, the effect of all these medications on the unborn baby. So intrauterine growth restriction, and then it can lead to CNS underdevelopment of the brain, and it can lead to eye defects as well, and it can lead to hearing loss. Okay, so fetal warfarin syndrome, intrauterine growth restriction, CNS underdevelopment, eye defects, and hearing loss. Okay, now which other medication do we need to master? Diethylstilbestrol. And what are the effects of diethylstilbestrol on the baby? It can lead to vaginal clear cell cancer later in the life of the baby. Vaginal clear cell cancer. It can also lead to benign vaginal adenosis, as well as even miscarriage in the baby, and then preterm delivery. So these are complications of the use of diethylstilbestrol if you have a patient who is pregnant. Doctors, I need to know, are you tracking with me? If you are tracking with me, I need you to type yes, 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 so that I'll know that you are tracking with me. If you are tracking with me, please type yes, 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 so that I'll know that you are really, really, really tracking with me. If you are tracking with me, kindly type yes, 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 so that I'll know that you are tracking with me. And make sure that you invite your friends to join this live stream. It's live streaming on Facebook, it's live streaming on YouTube, okay? So please, make sure. So I want to hear, if you are tracking with me, complications of cocaine in pregnancy, complications of diethylstilbestrol, complications of warfarin, complications of steroids which are used in the first trimester of pregnancy. Okay? All right. So we move from there. What about alcohol? What's the effect of alcohol in pregnancy? Alcohol can lead to fetal alcohol syndrome. That's number one. Number two, cleft palate. And then number three, cardiac abnormalities. So alcohol can lead to fetal alcohol syndrome. And if you are preparing for your QE1, you realize that we've dealt with this extensively in the MedCognito portal, right? It can also lead to cleft palate, and it can lead to cardiac abnormalities. These are the effects of alcohol in pregnancy. Now, what about methotrexate? With methotrexate, there can be CNS defects. There can also be craniofacial abnormalities. There can be abnormal cranial ossification. There can be intrauterine growth restriction. And there can be mental retardation. Okay? So, CNS defects, craniofacial abnormalities, abnormal cranial ossification. So, abnormal, closure of the bones of the head, intrauterine growth restriction. So the baby is born, baby is very small, and then mental retardation. These are the effects of methotrexate in pregnancy. Okay. Now, today we're keeping it very simple. So now that we've gone through this, let's try some questions. I'm going to read a question and then you type the answers for me. So you have a 38-year-old woman who is 8 weeks pregnant, and the patient presents to a prenatal visit. She has a history of high blood pressure and was prescribed ACE inhibitors before her pregnancy was confirmed. Now, her primary care physician is concerned about continuing this medication, which is the ACE inhibitor. Number one, what teratogenic effects are associated with the use of ACE inhibitors during pregnancy? What teratogenic effects are associated with the use of ACE inhibitors during pregnancy? That's the first question. The second question is, what should be a priority consideration in managing her blood pressure now that she's pregnant? What should be a priority consideration in managing her blood pressure now that she's pregnant? And number three, what might be a non-pharmacologic intervention to help reduce the risks associated with high blood pressure in pregnancy? What might be a non-pharmacologic intervention to help reduce the risks associated with high blood pressure in pregnancy? So let's start with the first question. What teratogenic effects are associated with the use of ACE inhibitors during pregnancy? I've seen that Dr. Richard said urinary malformations. So what are the teratogenic effects? It can lead to intrauterine renal insufficiency and urinary malformations, as Dr. Richard said. Okay. It can also lead to neonatal renal failure, ACE inhibitors. And it can also lead to craniofacial abnormalities. So please, doctors, make sure that you have mastered the teratogenic effects of ACE inhibitors in an unborn baby, right? Because today we are learning about teratogenic drugs. Number two, what is the priority consideration in this patient? So your number one priority consideration in this patient is to discontinue the ACE inhibitor. And you want to substitute it with a safer antihypertensive option. So I have a question, doctors. If you are going to discontinue the ACE inhibitor, what other medications, what other drugs can you give for high blood pressure in pregnant patients? I want to see you listing some of them in the comment section. What drugs can you give to a pregnant patient in pregnancy? What drugs can you give to a pregnant patient in pregnancy? I want to know, what drugs can you give to a pregnant patient in pregnancy? I want to know. Okay, so Dr. Richard went for metal-dopa. Apart from metal-dopa, what can you give again? Dr. Sabiha also went for metal-dopa. Apart from metal-dopa, what other drug can you give? What other drug can you give apart from metal-dopa? Apart from metal-dopa, what other medication can you give for high blood pressure, which is safe in pregnancy? This medication is very common in Canada. which other medication can you give which is safe in pregnancy for high blood pressure apart from metaldopa? Apart from metaldopa, what other medication can you give in pregnancy? So Dr. Sabiha says beta blocker. Dr. Sabiha, can you be more specific? Which beta blocker? Can you name the name? And I think Dr. Sabiha is trying to talk about labetalol. Labetalol, right? Labetalol. And then Dr. Jakilu went for nifedipine, amlodipine. So most of the time we go with nifedipine, sure. You can also go with labetalol. If the blood pressure is very bad, you can even do hydralazine, Yeah, okay. You can do hydralazine. Beautiful, 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 beautiful. Okay. Now, what are non-pharmacologic interventions you can institute, to help this particular patient? The non-pharmacologic interventions can be dietary modifications like dietary approach to stopping hypertension. That's a DASH diet, okay? And then you can also encourage the patient to reduce salt intake. They can reduce stress, okay? So stress reduction techniques, and you can even encourage exercise. If the patient has already been exercising prior to getting pregnant, they can continue that same routine exercise, okay? So that can really, really help them. So doctors, today we've reviewed the teratogenic effects of ACE inhibitors. We've reviewed the priority consideration in a patient who is taking ACE inhibitors and the patient is pregnant, and we've learned that we need to stop it and then switch to another medication which can be used like labetalol, like nifedipine, right, in pregnancy. And then non-pharmacologic interventions like dietary modifications to stopping or dietary approach to stopping hypertension, salt reduction, and stress reduction techniques. Okay, so now let's go to another question. Doctors, I have a question. Has this session, is it making sense to you now? Is the session making sense to you now? Is the session making sense now? I've seen Sergio Danso giving us thumbs up. Beautiful, beautiful, beautiful. So I see some other non-pharmacologic options that, other doctors are talking about. Okay. So let's look at another question. You have a 25-year-old pregnant woman. In her first trimester, is found to be taking carbamazepine for epilepsy. Carbamazepine. Her obstetrician discusses the potential risks associated with this medication during pregnancy. What teratogenic effects are associated with carbamazepine use during pregnancy? Indicate one. So that's the first question. And then, what birth defect is particularly noted with carbamazepine? And then, if carbamazepine is continued, what screening might be considered to detect any possible defects early in the pregnancy? So, carbamazepine. What are the effects of carbamazepine on the baby? So, I see that Dr. Sabiha says neural tube defects. Dr. Sabiha, don't forget that in the TDM exam, like in the CDM for QE1, if you are listing your answers, list one answer per line, okay? So neural tube defects, CNS underdevelopment. Any other person want to add anything? What are the effects? What are the effects of carbamazepine on the unborn baby? Neural tube defects. Okay, what birth defect is particularly noted? And then if carbamazepine is continued, what screening might be considered to detect any possible defects early in pregnancy? So carbamazepine can lead to neural tube defects. It can also lead to cardiovascular malformation. So doctors, please write this down. So as you are preparing for your exam, you can learn these things. Carbamazepine can lead to neural tube defects and cardiovascular malformations. And then the specific birth defect we are concerned about is the neural tube defects, okay? And what screening recommendation can we do for a patient who is taking carbamazepine? You want to do maternal serum alpha-fetoprotein testing, and detailed ultrasound to assess for neural tube defects. So these are two things you want to do. You want to quantify the serum alpha-fetoprotein levels, and then detailed ultrasound to assess for neural tube defects. So doctors, that is that for today's class. Today's class, I wanted to keep it very simple so that we can, get as much information as possible. Always remember, and I'll go back to the table we had. Always remember, these are drugs which are therapeutic, which are teratogenic, okay, in pregnancy. So always remember them. And don't forget that ACE inhibitors, carbamazepine, cocaine, steroids, warfarin, diethylstilbestrol, alcohol, valproic acid, methotrexate, okay, phenytoin, lithium. So the ones we did not mention, take your time, go into them. What are the complications of thalidomide in the unborn baby? What are the effects of tetracyclines? Tetracycline will make if the baby develops teeth, they will become discolored, right? Thalidomide will lead to abnormal limbs. Misoprostol can lead to, abortions and all that. So these are things you want to really, really learn and master so far as your QE1 and your TDM are concerned. I want you to be aware that currently we have TDM classes which are going on towards the January TDM exam. Okay, TDM classes are going on towards the January TDM exam. And that is why we held this class, so that you'll be aware of the fact that TDM classes are going on. So for those who are asking how to register for the TDM class, I'm putting the link in the comment section, and you can use that link to register so you can come into the TDM class. And I'll also, what I'll do is I'll also share the link to the TDM class, so you will actually see how to do the registration. Okay, so I'm just going to share my screen, and then you will see how it looks like. So to register for the TDM, it's only $1,200. Okay, just $1,200. That's what I've indicated here. Okay, you can decide to pay it one time, or you can decide to pay it over 2 months, or you can decide to pay it over 3 months. So if you're paying it over 3 months, it's just $420 a month for 3 months. If you decide to pay it twice, it's just $610 a month for 2 months. And you can decide to pay it one time as well. When you come in, you have access to everything that MedCognito has to offer. You get TDM mock exams every Wednesday from now till the exam. Tonight, there's a TDM class. Tonight, there's a TDM class. Tomorrow, there's an MCCQ1 class. Okay? But tonight, for those who are going to practice ready assessment, tonight, there's a TDM class. Okay? And just for $1,200, you'll be getting weekly classes till your exam in January. All right? You will get mock exams you need to do on your own. You get replay of the live classes as well. You'll also get replay of all the pre-recorded TDM classes. So doctors, it's good to have a conversation with you, and it's good that you are preparing for your TDM. Make sure that you click on the link to register and then join the TDM class so you can get the best out of the classes we are organizing. Thank you very much, and see you in the TDM class tonight, and then see you in the MCCQ1 class tomorrow. All right, so that you can get the best out of whatever it is that we are dealing with. If you also want to reach out to me, don't forget that my phone number is +1 306 891 5649, +1 306 891 5649, +1 306 891 5649. Send me a message right away, and then let's get talking as you prepare for your TDM, your MCQ1, your NACOSKI, and everything. So Dr. Sabia has a question. Are live mock tests included in the course? So the live classes are, live mock exams where you are being quizzed orally by the tutor. But then you have 6 sets of mocks, which you will do in your portal as well. And we've done a video recording to also explain why your answers you chose were right and why your answers you chose were wrong. So that is that for the TDM course. We are currently running it. Tonight there's a class. Next week Wednesday there's another class. Next 2 weeks Wednesday there's another class. On and on and on and on we go. So doctors, see you. Have a wonderful day. And thank you very much for joining me on this live stream. Enjoy your day. And don't forget the effects of teratogenic drugs on the unborn baby. Thank you very much. Enjoy the evening. Bye-bye, 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 bye-bye.